Hello, hi, and namaste. I am Vishwan Mohanty. Today we are going to discuss about a very particular topic, which is general health. So, to discuss about general health, today we have invited one of my favorite doctor in the podcast. He is more than 50 years of practice in the field, and age is nearly 8 years of age, and he's been practicing a lot of patient in his careers. So, let's dive into the discussions general health, and we'll come to know so many things about the general health. Let's welcome our today's guest, Dr. Chandra Sekharam sir, and let's welcome.
Thank you. It is a good opportunity for me to see number of people who are interested in general health, how things have changed during this 50 years period. Okay, are you with me?
So, sir, let's discuss about general health. As you practice 50 years in the field of surgery, and you have gone through a lot of patient experiences, and people are coming with different problems, and you have given a lot of solution for them. My first questions and my what I'm trying to convey my questions is that how long have you been practicing in this field?
Yeah, I'm in the practice for more than 50 years in general practice, and as a surgeon, I have been in the field operating from almost 1972.
1972. Okay.
So I have come across many changes in the pattern of disease, pattern of investigations, and the approach of patients, their moods, then the availability of health services, which are more now than earlier. All these things have happened all through these years.
So it's I think more than 52 years you
Yeah.
have been practice.
Yes.
So in this is a long period of time. 52 years means it's a vast period of time. So in this period of time, you have observed so many patients, right? So what kind of patients you have seen? What kind of treatment you have seen on that time and now?
Yeah. This is actually the World Health Organization defines health as a physical, mental, environmental, social well-being.
Okay.
So there are so many aspects of health. Disease is okay, but health, we have to be in good health in the body, in our surroundings, in our environment, with people around us. So all these things are a part of good health. Actually, we are the present medicine. It is only healing the disease portion of it. The general health portion of it is not being taken care of.
Okay.
So, when we teach medical students, the disease itself is defined in the following steps: one, accidents, then congenital anomalies, then cardiovascular and other anomalies, disease, malignancies, that means cancers, degenerative disorders.
Okay.
Like this, we classify them into different things. So, of these, the accidents, even though they are avoidable because many factors are involved, accidents do occur. So, we have to face them. Like that, malignancies, cancers, they occur. They also occur because of various factors, and we have to have treatment for them. Then infections, because of unhealthy atmospheres, closed atmospheres, then viral spread, the infections occur. They also need treatment. Congenital disorders, again, they need medical and surgical treatments.
Yes.
Degenerative, as we age, there are changes occurring like degeneration in the joints, cataracts in the eyes, hard of hearing in the ears. These things happen as we age. So degenerative disorders, then mental confusions, Alzheimer's disease, all these things occur as we age. Then these are the degenerative diseases we come across. But if you take all these diseases, accidents, malignancies, they constitute only 40% of the disease,
Yes.
whereas 60% of the disease is an unnecessary, avoidable disease which we can manage with a good, regular behavioral patterns. So, if we see any medical clinics or hospitals all over the world, more than 60% of people they don't need any treatment. If there are so many systems like Ayurveda, homeopathy, Unani, so many are there, allopathy, all these pathis are surviving in this 60% group where anyway they will heal on their own. Whereas the 40% they need expert treatment, a trained doctor is necessary to control these diseases.
Right.
So this is the pattern of disease which is generally there in the society.
Do you ever notice till today? Do you notice any kind of pattern of change, like a disease pattern or a treatment pattern, then and now? What is the difference you have noticed?
Yeah. So if you say from 50s to today, there is a lot of change.
There is generation changes also.
Yeah.
We've seen.
In the social conditions, the availability of drugs, then the technical advancements with availability of so many laboratory investigations, radiological investigations. There is a lot of difference. In the beginning of my career, the gadgets I had were
Yes.
a stethoscope, BP apparatus, and my hands.
Okay.
Beyond that, there is nothing. Even in the operation theater, for controlling the bleeding, a diathermy apparatus was also not there.
Okay.
And after some time, a diathermy apparatus come only on the head of the unit used to operate. Others used to ligate and then control the bleeding points. So like that, there was no parameter and there were no gadgets to study the parameters. So only our observations, how the patient is. Now after that, we have so many gadgets, say pulse oximeters.
Yes.
From thanks to COVID, every household had a pulse oximeter. Then different gadgets like BP monitors, simultaneous ECG monitors continuously, echocardiography, CT scans, MRIs, X-rays. All these things have been possible through these years, through the technology. Now the disease also has changed. In the earlier periods, there used to be one disease called beriberi.
Very.
Very,
Yes, I
very.
heard.
Yeah. Where the people used to suffer with swollen limbs. It was a common disease when when we were medical students. Then it is due to B1 deficiency.
Mhm.
Now that is rarely seen today.
Yes.
Even other vitamin deficiencies, they are coming down. Then smallpox has disappeared from the earth.
Yes.
Polio has disappeared. So definitely there were changes from that period to this period. Then in that period, the whole world was poor actually. There was not much money there. And then people were starving for food. And then there were no amenities excepting for madly rich people. Other even moderately rich people were as good as the poor people because there were no radios, no telephones, no electricity. So everyone was same. Now you see, electricity has come. After that, radios have come. Then televisions have come. Then more smartphones have come. So now we have a comparison for everything. In those days, even transport was also not there. A horse buggy was the
Yes.
one that is used by a rich person. Others used to walk. Then bicycles. Then motorcycles came. Then cars. Now a comparison of vast cars, this car, that car.
Yes.
He is having a big, costly car than me. Like that, comparisons have come like that. Life has changed all through the years, and then due to industrialization and all, there is a lot of rotation of money and social understanding. Food amenities have increased, and then at that time there was not much food. Now we have
Plenty
food,
of
plenty of varieties of food coming all through the seasons. All the fruits come today.
food is like that. Who has more money can afford more food, and even different kinds of food.
Food also, variety of food is also there. A good food was only on an occasion.
Yes.
In Telugu, they used to say, "Pappu annam eppudu pedtavu?"
Papa,
Pappu annam.
papa,
That is rice and
dal.
dal. It is a luxury for a average man. So that was only served in a marriage.
Yes.
So they were looking for that. Now today we have so much of availability
Yes.
to all people. So because of that, there is also a change in the disease pattern.
Yes.
When I was a medical student, duodenal ulcers with obstruction, they were common. 3 months abdominal pain, obstruction used to be there, or perforations used to be there. Now with the advent of drugs like H2 receptors, the ulcer has almost disappeared. If at all we have a complication, it is a bleeding that may occur, occasionally very rare. And the common operations in 70s and 80s were GJ vagotomies for duodenal ulcers. 4 to 5 cases per theater used to be there.
Why?
Because
Why that much?
ulcers were there at
Okay.
that time. Now the ulcer pattern has changed and the ulcers are now controlled with only tablets, and so there is no need for surgery like that.
Okay.
So there is a lot of change like that. Then tuberculosis was very common. Even now it is there, but it is not to the extent it was there in earlier times. And we have good drugs. I had typhoid when I was about 10 years old. Then there was no drug for typhoid. Fasting for 21 days was the only treatment. Now we have then chloramphenicol has come. Then other drugs have come. Now the complications of due to typhoid are very rare.
Yes.
So that is how there is a change in the pattern of disease.
And also the treatment also.
Treatment also. Now we have so many drugs to treat. And
Drugs,
actual
technology.
diseases we can treat. Difficult surgical procedures can be done. So there was a time when people thought no one can enter the thorax. Now heart surgeries are done easily. No one could imagine that brain could be opened. Now brain surgeries are done. Like that, there is a lot of advancement in all the fields. So we are doing greater surgeries, and
Yes.
then better treatments are being given. The respiratory care is good. Neurosurgical care is good. Everything is happening well nowadays because of so many gadgets, so many hospitals, availability, and then affordability also of the patient.
Yes.
And support from the governments. So there are many factors which are helping people to have good treatment.
Sir, I have a small note. In the discussions, there is food and disease. If you get more food, the disease you told that if you will have a more food and different types of food, you may get suffer with a lot of bad diseases on that one. So how it related?
No, because of the availability of foods, earlier the pattern, the people used to take only homemade food. Whatever is cooked in the house, they used to take. There is no use of package, and there was no use of packaged foods being used. Now, with the advent of industrialization and westernization, now we go for packaged foods, processed foods. Then these foods contain lot of corn sugar, which is high in sugars, and then you take lot of chocolate.
Yes.
Chocolate is bitter. To mask that bitterness, you add salt. To mask that saltness, you add lot of sugar. So what happened? And you like chocolates. Children like chocolates. Adults like chocolates. Chocolate creams, chocolate ice creams. What is happening? There is so much of sugar load. There is so much of salt load in this unnecessary food.
Yes.
So what happens? All these things, they get loaded in the body. So there is sodium retention. There is excess of sugar. So when there is excess of sugar, naturally there is excess load on the pancreas. The excess load on the pancreas, then the insulin resistance will be there. So like that, they will go for diabetes. So hypertension, diabetes, kidney disease, all these things came into existence only because of excess of sugar-rich, fat-rich foods which are available and we are consuming.
In the packaged food.
Processed foods.
Processed food. Yes.
Company-made foods, and then in the hotels, where all these things, they are nerve stimulants.
Okay.
So they cause problem and then disease. That is the main problem is the availability of corn sugar foods.
Corn sugar
food. It is rich in sugars, and then that produces excess. Everybody is high cholesterol levels. Then blood vessels become blocked. So hypertension, cardiac disease, diabetes, they all go together because of the food only. Added to that, the life is also comfortable. Earlier, they used to get water, they have to go to a well or to the nearest river and then bring water.
From the well and get
then
some
water from, there is physical problem, exercise that is there. And then you want some powdered wheat, you have to make it grounded in your own home. Other things are there, not there. Now everything is available in packet, and that is the main reason.
And to keep it for more days, they are adding different kinds
preservatives.
of preservatives.
So they also cause some. And then earlier, majority were agriculture laborer worked in the fields. So they have a lot of physical work. Now we are most of 80% are now in the white collar jobs. Yes. Air conditioned places. You move on a transport, your transport is there. Earlier they used to walk miles together. Yes. To go to a school, we have to walk 3 to 5 kilometers per day. Yes. Whereas now you take your children by your vehicle to the school. Even the children don't have an opportunity to mingle with other children and play. Because there are no playgrounds, schools don't have playgrounds. So there is no physical exercise either for children or for adults. And then if you want to make the children play, you have to go to academies where few people can afford. Okay. And then a particular group of financial status people are there. They don't know about the common man, common people. So that social differentiation is also there.
Sir, if you are taking good amount of food, if you will not consume it properly, so it might affect your health. Right?
Yeah, excess food you should not take. Okay.
Yeah, you have availability, you have affordability. So people are spending a lot of money in their food.
Yeah.
Nowadays, what I've seen, so if you go to a restaurant or if you're going to a mall, there are a lot of things are there in and out to you can purchase and you can eat and you can have it. So on that conditions, as per your year, you should avoid all this kind of packaged.
Packaged foods should be avoided. The other thing is when you take all these foods now, the intestinal flora also changes.
Okay.
That is, now have you heard about biomes? Biomes.
No, sir.
They are healthy microbes that are there in the intestines. Mm-hmm. They will help us maintain good nutrition. Okay. Whatever food we take, they also take that. The number of healthy microbes in the body are more than the number of cells in our body.
Biomes are more.
Biomes are more than, they are there everywhere in the body, and their count is more than the number of cells in our body. Okay, so that such an important group is being ill-treated by these foods. Repeated use of antibiotics, then repeated these irritating foods, lack of fiber. These things will damage the microbes. See, the microbes themselves, they are very good. They secrete neurohormones, which will help our general health. So they have a connection. The neurohormones secreted by the biomes, they will be in contact, coordinating with the brain cells, heart cells, and then intestines. So they are all working in union. So if this microbial pattern is disturbed, naturally diseases come. Like even a heart attack is supposed to be due to this one. Irritable bowel syndrome. You may have abdominal pain, incomplete evacuation, or frequent evacuation. All these are possible because of disturbance. Then food allergies. There are people who can't take milk, people who can't take rice. They can't accept any food. They immediately have to go move the bowel. So they are disturbed.
Yes, yes.
So these food allergies are common. And then other allergies, everything is now projected to the microbes, healthy microbes that are there in the body. They have to be respected, honored, and then nurtured. So all the foods we take also must see that they are taken care of.
As for your point of view, as general people or normal people, as common people, what kind of food they should take and how many times they should take in a day?
According to me, if a person is overweight, I will start with the evening. The evening food should be around 7 and 7:30.
Okay.
So that by the time they go to sleep, their 3/4 digestion takes place.
Okay.
Otherwise, if you take food in the late hours, what happens is reflux will be there. Then you are disturbed, your sleep pattern is disturbed. So you have to take evening meal early. Then mornings, according to the working pattern, you have to plan. Around 1:30, you take the lunch. Then as far as possible, avoid heavy carbohydrate load in the mornings. If you want to reduce your weight.
Okay.
If you are normal in weight, you can take your food. Then in between munches is not a good habit. So usually around 11 o'clock, they may take a cup of tea or a biscuit. Then evening also. But constantly availability of food, you go on eating, then that is disturbing. And as far as possible, we should take food, homemade food only, not outside.
So in a day, 3 times.
3 times.
A day, and small snacks in between.
5. That makes 5.
Okay. Not snacks. 3 meals.
3 meals.
And the evening meal should be before 7 o'clock.
Yeah.
Sir, while discussing this one, another question came to my mind. Nowadays, because you have been practicing this long period of time, so nowadays people are affecting more in heart, cardiac arrest, heart fail.
Yeah.
It was there before, or nowadays they're suffering more?
Yeah, heart attacks are a recent phenomenon only, because the changes that have occurred in late 70s, availability of food, lack of exercise, these things have contributed more. The other thing is, after Corona, there is a sudden rise in the heart attacks. Then the occurs mostly in younger age groups.
Yes, yes.
Because those people who are attacked by Corona, the blood vessels are involved in all those people. Inflammation continues. Even if we see the tests now, we can make out
Yes.
whether they had a corona attack at that time. So those people definitely, excessive exercises, they are the cause for heart attacks in younger age groups. Lack of sleep, excess work, excess stress, and then excess exercise, a consciousness to have a good body. So you have seen very young people dying because
Yes.
of this one. Then atherosclerosis, and it is a degenerative process that occurs.
It is an excessive stress, and I saw in videos that few people were in the gym and they died
Yeah,
at the
gym.
gym only. Why this is happening nowadays? Previously, I have not listened. After Corona, I listened all this thing.
Only recently, a 34 years old bodybuilder,
Mhm.
world famous, he died of heart attack.
Okay.
So there is a stress. Excessive exercise is always bad. Moderation in exercise, moderation in play, everything in moderation is always good, because if you practice tennis, you don't have to play in Wimbledon. It is for your physical exercise, you try to learn.
Yes.
Like that, if your ambition is that much, it is okay. If you want to be competitive and all, you have to take that much of stress.
I have a question, sir, because if you just now we discussed stress. Previously, the stress was there, but the stress was different.
Yeah,
Nowadays, every people are suffering with stress,
yeah.
but this stress is different. What is your view on
But,
this?
yeah. Earlier, people only have nots.
Have
And
yes.
there was only a financial problem.
Yes.
There are people who had money, uh, and there are people who had to take loans, and then for the marriages and house building and other, then they have to repay. Though that stress was only there in those days. Nowadays, the problem is not like that. From LKG student to the senior executive, there is a stress continuously to reach to targets to achieve, like that. So nobody wants to be mediocre.
Yes.
Everybody wants to be on the top.
Top.
So they are stressed naturally. So that atmosphere of competitiveness for friendship and other things are not there. Only you want to override others.
Yes.
That is the cause. And then there is this smartphones, Facebook,
Yes,
and
sir.
then Twitter. Everywhere you always compare. You see, somebody takes a coffee in a big hotel.
Yes.
He puts a photo. Then you think he is very happy and he could go there. I am not able to go there. You feel unhappy. So actually, he is also not happy there, but we
Right,
don't
sir.
know. In this world, nobody
Yeah.
is happy because of external things.
Everyone is suffering
Mm.
with their own.
Oh, yeah, it is man-made only.
Yes.
Because you compare with others, you suffer.
Yes.
If you are content with yourself and do best to others, you are happy. It is as simple as that. I will tell you, we have to be grateful for whatever we have. If that is there, stress will not be there. That is known as gratitude. So we should have regular habits, a diet that is rich in vegetables.
Sir, as you have discussed now that so many diseases, so many kinds of problems people are facing mentally, physically. So, as per your view, how we can overcome all these issues, all the diseases, and we will get a new society.
Yeah.
Some kind of.
This is all possible only by disciplining ourselves and then teaching our children to have a disciplined
Discipline life.
Because I will tell you a small example. My grandchild has left his plastic water bottle in the home and went away to school.
Okay.
When his mother asked on return, why you have left the water bottle, he said, it is made of plastic. My teacher in the class told me that plastic should not be used. So when you tell children something, it goes into their mind and it is very effective. So our children should be trained in a proper way.
Yes.
Our parents may not have been educated. They did not know how to groom us. They have given us all the comforts, all right. But spiritual way of life, disciplined way of life, we are learning because of so many facilities that are available now.
Yes.
And then we should inculcate good habits in children. And for them to follow, we should adopt. That is the only way. Disciplined way of life is the best way. And then regular exercises, homemade foods preference, not going outside just for the fun of it. That should be practiced.
Yeah.
And then regular exercises, because we are not doing a great heavyweight work. So majority, they should have regular exercise. And then be a competition to yourself. Don't compete with others.
That's
That
the
is other
stress
thing.
management.
Yeah. That is, don't think other man is better. No, nobody in this world is really happy and comfortable. You have to be comfortable yourself to make others happy and comfortable.
Yes. Yes.
So for that, if you are a religious person, whatever religion you follow the regular rhythms of the religion, and then be in the habit of regularly reading a spiritual book before retiring to bed instead of seeing it TV, something in the TV serials, and then going to sleep, because electronic gadgets before sleep, they disturb sleep. So 1 hour before going to bed, you should always read something or hear something that is good spiritual, and then retire. Then help your neighbor.
Yes.
Always be in that mood to be of use to the society. As I said,
Yes.
the whole nature is helping us. We should also be in that helping nature. Then naturally good health will be there. If everybody follows it,
Yes.
there will be good
Good
health.
society. Good society, good world,
And
good India. Healthy India. Thank you, sir. Today we have discussed a lot of things regarding general health, and in near future again we will come with other topics of discussion. Thank you, sir. Thank you, sir. Thank you for coming.
thank you very
to our
much for
podcast.
giving me
Thank you.
this nice opportunity to be with all of you.
Thank you.
Thank you.
Thank you.